So just so everybody knows, we are starting to stream now. Just waiting for 3 more people to join in.
Welcome. Thank you. Let's start with your name, please, sir.
My name is Archie Williams.
So where are you from?
I'm from Louisiana.
Louisiana. Right, let's get to know you first of all.
Hi, Councillor Kushner. We're live on YouTube right now. We've just got the promotional slides going right now. Can you hear me okay?
Yes.
Okay, great. Can you just turn or just mute your microphone for now, just before the meeting starts?
Okay, I believe we're ready. I'll look to the council coordinator for the thumbs up.
We are ready to go, Mr. Mayor, and I'm just going to start right now with O Canada. So I'll do a screen share now to share that to everyone's computer.
Thank you.
Oh, Canada, our home and native land, true patriot love in all of us command. Car ton bras s'est porté le paix, il s'est porté la croix. Ton histoire est une épopée des plus brillants exploits. God keep our land glorious and free. Oh, Canada, we stand on guard for thee. Oh, Canada, we stand on guard for thee.
All right, thank you very much. Another beautiful rendition of O Canada. Very fitting after a great Canada Day here in our city and in our country, something that we could all be proud of. We begin the gathering by acknowledging the land in which we gather as the traditional territory of the Haudenosaunee and Anishinaabe peoples, many of whom continue to live and work here today. This territory is covered by the Dish with One Spoon Wampum Agreement and covered by the Upper Canada Treaties. And today, this gathering place is home to many First Nations, Métis, and Inuit peoples. Acknowledging this reminds us that our great standard of living is directly related to the resources and friendship of Indigenous people. So before I go to the adoption of the agenda, I just want to thank Council for taking the time to convene this special meeting of Council. And there's staff who are joining us today, and I want to thank them for the efforts that they've put into getting us to where we are here today. It is an important subject that we'll be discussing, and there's a lot of feedback that we've heard from the community. And I'll get into that just before we put the motion on the floor, but I would just like to acknowledge all of Council for their efforts and our staff as well for stepping up as well. I'll look to the clerk for the adoption of the agenda.
So amendments for today's agenda. It was republished this afternoon to include report LCS 104-2020. This report contains supplemental information from staff related to the wearing of masks and face coverings motion. The report does not need to be considered separately, rather it's just in response to the motion. To that effect, we were just going to ask that the motion be amended to include additional clause to receive the report for information purposes. It's kind of just a housekeeping thing for us to finish up that report. And then additional correspondence from the following individuals has been placed in Council Sugar Sync folder regarding item 3.1. Correspondence from Tamara Komar, Elizabeth Platts, Lorraine Nadeau, Aaron Anderson, Alexander Buck Andrews, Louise Rivette, Lori Davidson, Susan Merritt, Frida, her last name is unknown there, Michael R.S. Wilson, Marla Summer, Lara Komar, Karen Kennedy, Wesley Kavanaugh, Janet Jansen, Judy Gabay, and Jody Handrahan. Since we do not have a correspondence report today, these items of correspondence would be received for information when the agenda is adopted.
Okay, I don't think there's any further amendments to this agenda, as there's only one issue on the agenda in front of us today. So can I have it was Deputy Mayor Dodge is making the motion to adopt the agenda.
So moved, Mr. Mayor.
Seconded by Councillor Phillips.
Yes, seconded by myself.
Councillor Sorrento, you have your hand up.
Just going to wait till the motion gets on the floor, Mr. Mayor, procedurally. Thank you.
Okay, great.
Thank you.
Okay, so there is a council adopt the motion. So that council adopt the agenda for the special meeting. So we've already, okay, so council adopt the agenda for the meeting of July 6th, 2020 as amended, that the council receive and file the items of correspondence distributed to the meeting held July 6th, 2020. All in favor? Okay, that's carried. Thank you very much. I don't think there's any conflicts of interest on this issue before us today. So we do have a motion that has been brought forward. The motion will be moved by Councillor Townsend. And just prior to getting into the motion, just want to provide some context in terms of what the intention is for today. So the intention for today, after Councillor Townsend goes through the motion, is really, do we want to decide as a council to have staff develop a bylaw that could be put in place at some point in the future that would allow for the city to have a mandating of masks? So today is a decision of yes or no, do we want one to be developed? The outcome, you'll see some amendments that'll be brought forward. The outcome is that on Monday of next week, July 13th, there will be a further discussion about the bylaw itself. And the intention is to invite the director of medical health for the region to come in and speak to council in this platform that we're here, so that you as councillors can ask some further questions. So I think we've got a lot of information that have been circulated through the community, and it is very much, there's a lot of different items to consider. So I think today the yes or no decision is, do we want staff to proceed with the development of a bylaw that we can then consider on the 13th? And we can look at how that would come into effect, or when it would come into effect. So that's just laying the stage for the next 7 days, I guess is what I'm asking. So with that, I'll just ask Councillor Townsend if he wants to put the motion on the floor, and then I'll have Evan put the motion on the floor.
Thank you, Mr. Mayor. I'll put the motion on the floor. Would you like me to read all of it as well, just so council knows what the is all referring to? Okay. All right, moved by myself. Whereas the spread of COVID-19 has been declared a pandemic by World Health Organization, the city of St. Catharines declared a state of emergency, and the province remains under emergency orders due to the health risks to Ontario residents arising from COVID-19. And whereas COVID-19 continues to be present within the city and is a disease that is readily communicable from person to person, even with minimal or no signs of symptoms or illness, and carrying a risk of serious complications such as pneumonia or respiratory failure, it may result in death. Whereas there's a growing body of evidence on the effectiveness of masks and face coverings to act as a barrier to prevent the spread of COVID-19, whereas wearing masks and face coverings may act as a visual cue that public health measures, including maintaining a physical distance from others, are still required, that the COVID-19 pandemic is ongoing, and that the resurgence of local disease activity remains an ongoing threat. Whereas the province of Ontario has enacted regulation 263-/20 stage 2 closures under subsection 7.0.24 of Emergency Management and Civil Protection Act to permit certain businesses to reopen for attendance by members of the public, subject to conditions, including the advice, recommendations, and instructions of public health officials. And whereas physical distancing is difficult sometimes to maintain in enclosed spaces open to the public, therefore be it resolved that City Council enact a temporary bylaw requiring individuals, organizations that are responsible for the operation of a facility or businesses which have enclosed spaces open to the public to ensure no member of the public is permitted entry unless wearing a mask or face covering to help limit the spread of COVID-19. Be it further resolved that masks or face coverings must be worn unless it is reasonably required to temporarily remove the covering for services provided by the establishment or while actively engaging in an athletic or fitness activity during physical activity, and exemptions may be accommodated if the person is under 2 years of age, the person has an underlying medical condition which inhibits their ability to wear a mask or face covering. Wearing a face covering would inhibit the person's ability to breathe in any way. The person is unable to place or remove a mask or face covering without assistance. Employees and agents of the person responsible for the establishment are within an area designated for them and not for public access, or within or behind a physical barrier. Be it further resolved that employees working with members of the public and members of the public in an enclosed space must also wear a mask or face covering unless they are in an area not for public access or within or behind a physical barrier, or they meet one of the exemptions. And be it further resolved that the bylaw also apply to the City of St. Catharines facilities open to the public, such as community centers, libraries, and public transit. Be it further resolved that the bylaw be enforced for the temporary period of time beginning July 14th, 2020 and expiring August 24th, 2020, unless extended by City Council, and be it further resolved that the city solicitor be directed to prepare the necessary bylaw. I will speak last to this, Mr. Mayor, if that is okay, and I will open up the table for council to begin speaking.
Okay, thank you, Councillor Townsend. I believe we have Councillor Kushner seconding it. So we've got a couple questions on the floor already, and we've got Councillor Sorrento and then Councillor Williamson. Councillor Sorrento, you're up. Councillor Sorrento.
Oh, I'm sorry, Mr. Mayor. I just see the motion in front of us here. Mr. Mayor, just a point of clarification. I thought we were going to be having a fulsome discussion about this today, but I see that your request is just to have staff create the bylaw. So essentially, that's all that we're speaking to. This is the decision today, as opposed to getting into the details of the motion. Is that correct, Mr. Mayor?
Well, I think it's important that we focus on the details of the motion and what council would like to see in a bylaw. And then that way staff have the direction to go away and prepare one for the July 13th meeting. So there needs to be, and I will allow, I'll have the solicitor provide some feedback just after Councillor Sorrento, because I think the report touches on some of this. There is a period of time that has to take place between the passing of this and the introduction of the bylaw. So there's a reason why we have to go through this step.
Okay, thank you, Mr. Mayor. Then I'll make it very brief. That was actually one of the questions that I did have, Mr. Mayor, to the solicitor. It was regarding the Occupational Health and Safety Act. But since you've already stated that, I'll just, I won't ask the solicitor. Mr. Mayor, I reached out to a number of healthcare professionals, and almost everyone is unanimous in the use of face masks when the physical distancing between people, among people, is not possible, and the hand sanitization. So what the professionals have indicated to me is that the hand sanitization, the physical distancing are very, very crucial in all this, Mr. Mayor. And then the mask would come in as a secondary defense, a secondary line of defense. So I have just a couple of questions. Have we allowed for any other contingencies where people cannot wear masks? I know there's a clause in the motion there that exempts certain individuals. Have we missed any groups such as seniors or places of worship so that we can include groups of people that are not captured in that particular clause, Mr. Mayor?
Okay, good question, Councillor. And what we'll be doing is, if there's groups that you're concerned about, I think you get them noted to staff so that they can provide some feedback as to what is the scope and extent of this. So right now, we're not in a position to be able to say yes or no towards the groups that you mentioned, but I think it's something that should be noted for staff to consider when they bring back the draft bylaw.
Okay, that's great, Mr. Mayor. Now, regarding the residents, I've heard from a lot of residents, and right now I have almost a 3-2 in favor of residents in wearing the masks. So should it be the will of this council to pass this and to move forward, I would only say this, Mr. Mayor, that I certainly hope that there will be no judgments made by anyone, anywhere, at any time, because we don't know what the situations are if a person or people cannot wear masks. And Mr. Mayor, we are all in this together, sir. We're looking after each other. It's not about us as a council. It's about our entire community and the well-being of the community. So I would just hope that there would be no judgmental statements by anyone, anywhere. And I will defer to my colleagues. And thank you so much, Mr. Mayor.
Very well said. Thank you, Councillor Sorrento. Councillor Williamson, before I go to you, can I have the solicitor just provide some summary remarks on her report? Is that okay, Councillor?
Yep, sure.
Okay. To Director Salter.
Through you, Mr. Mayor, to council. Basically, the report is very, very brief. What I've attempted to do is sort of outline the current status in the province as of this afternoon in terms of municipalities or health unit areas of jurisdiction which have implemented policies. There's only a few that are actually in place at the current time. So I've provided you with a very brief summary of those, and they're attached as an appendix just to give you a flavor of the type of regulations that so far have been passed. We know that there are other municipalities that are looking at these. I believe the city of Brampton has given direction to their staff to prepare a bylaw, and I believe that the region of Waterloo, I'm not sure if they've given the direction yet or not, but they are definitely have a council meeting to debate giving that direction to staff. So it's very much a of the moment situation where municipalities and health units across the province are looking at this. So there's a variety of different ways in which the different jurisdictions have approached it. In some areas, it's the medical officer of health has exercise their authority under the Public Health Protection and Promotion Act to issue an order. That's the way that they've done it in the Kingston area and the way that they've done it in Guelph. City of Toronto has gone a different route and they've passed a municipal bylaw, but my understanding is also with the support of their medical officer of health. Brampton, I understand, is looking at a bylaw. I'm not exactly sure what the status of it is in the region of Waterloo, but there's a couple of different ways to go at this. My understanding is that our medical officer of health has indicated he does not intend to issue an order, and therefore, if we wish to mandate the wearing of masks, the way for us to do it as a council is to pass a bylaw. But briefly in the report, I highlighted some of the differences that appear in the bylaws. There's quite a lot, and the orders. There's a fair bit of consistency with respect to, there's two types of exemptions in these bylaws. There's exemptions that relate to people who are wearing the mask. So I think that was what Councillor Sorrento was referring to. Things like, children under the age of 2. There's some more detail, I think it's in the City of Toronto bylaw, about children under the age of 5 in certain circumstances, people with underlying medical conditions or unable to wear a mask because of breathing, it impair their breathing. Basically, characteristics of the individuals that would make it difficult or impossible for them to wear a mask. So that's one category of exemptions, and they're fairly consistent across the ones that we have seen so far. But as more developed, you may see some more categories. I know in Toronto's bylaw, they refer to also our obligation to make reasonable accommodation for people on the basis of characteristics under the Ontario Human Rights Act, which we would have to do in any event, but it's reflected in their bylaw. The other category that you need to be mindful of is the way that all of these orders and bylaws have approached the issue is not to regulate the public. They're all regulating establishments, largely commercial establishments, but also certain types of public facilities such as libraries, community centers, those sorts of public institutions, museums, etc. But the way that they have approached this is to regulate the operators of those establishments, not the members of the public themselves. So basically, the onus is on the operators of the establishments to ensure that they are prohibiting entry from people who are wearing masks. Toronto's is a little interesting because it actually just talks about them creating a policy. I assume that the intention is that they assume that businesses will in fact apply their policy. So bodies that are regulated are the establishments, not the citizens. So I just wanted to make that clear. But what establishments are covered, there is some variety among the 3 orders. It's not exactly the same. So that's something that also council will ultimately need to turn its mind to in terms of, what type of establishments should or should not be covered, because some have exempted some and some include them. Staff's not making any recommendation with respect to that today. Happy to hear from council if council has any direction for us. Otherwise, what we would propose to do is we'll take this week before the next council meeting to sort of look at all of the bylaws in detail, talk to the municipalities that have enacted them, find out sort of their rationale for what's included, what's not included, their enforcement plans, and also to speak with our local Department of Public Health, because they have offered to assist us in drafting the bylaws. So we're very interested in speaking to public health to determine what their recommendations are with respect to what should or should not be included as an establishment. So we will kind of go away and do all of that research and look at sort of best practices as well as any feedback that we get from council, and bring back to you something in, at the next meeting that will be staff's recommendation in terms of what should be included or not included. But that's kind of the bare bones of that. My recommendation to you would be to follow the same sort of path as the other municipalities in terms of the regulation should be a regulation which imposes on the operators of the establishment to enforce it. Mr. Mayor, I think that's all that I'd have at this time.
Okay, thank you very much for that. And thank you for the work that you've put into it last number of days. Even though it was a short report, the background is very important. I'm going to go over to the CAO just for a quick reference on transit, because I think there needs to be an amendment to the transit one.
Thank you, through Mr. Mayor. Masks, despite the ever-changing knowledge and education that's come surrounding in this pandemic, have been a topic of discussion in many municipal areas and predominantly in transit as well. As you know, transit with buses, enclosed spaces, capacity issues. So they had from the beginning looked at various modifications, mitigations of risk that they could do, and mask was always part of it, though as we've heard already, at the lowest level. So there was, the physical distancing and everything there. So transit has made many modifications on their buses, the shielding, the places where people can sit so that they don't sit side by side. We did rear bus loading for a while, and now that the transit drivers are more protected behind the covering, we're able to load from the front now. Masks, they have not. Much debate and much consideration across the various transit operators in the region. Masks, they have not made mandatory. They are very highly encouraging the wearing of masks as that additional layer of defense. However, there's a concern, which I think is very real from the transit operator's perspective, that they do not want to leave a passenger needful of service at the side of the road because they simply don't have a mask there. As well, should they not be wearing a mask, and then determining why, did an exemption apply? They felt for the service that strongly encouraging masks, but it certainly is the Transit Commission's decision and preference that remained there for their operations for a good number of reasons that they have considered very seriously.
Okay, so with the support of council, could we strike public transit? I'll look to Councillors Miller and Dodge, since they're on the Transit Commission. As two commissioners, could we leave it to the commission? Are you comfortable, councillors, that we leave it in their hands? I'm seeing Greg, Councillor Miller nod, yeah. So if that's okay, I'll make an amendment to that. And could it be a friendly amendment? I'll look to Councillor Townsend.
Yes, Mr. Mayor.
Okay, thank you. Okay, next on the list is Councillor Williamson, then Councillor Littleton, and then Councillor Kushner.
Thank you, Mr. Mayor. Through you to the solicitor, to the acting clerk. Since we had this meeting scheduled, the region now is going to have a vote on Wednesday on masks as well. If the region does agree to some kind of regulation on masks, just wondering if that makes what we're doing redundant, or I just wonder what the process will be for us if the region acts.
Through you, Mr. Mayor, to Councillor Williamson. Yeah, that is something that we will have to obviously have our eye on, and it'll be included in whatever report, you know, we bring forth on the 13th. I mean, we'll be moving, if council's desire is for us to prepare a bylaw, certainly we'll be working towards that direction to have something in draft to you for July 13th. If in the interim regional council makes some decision, we'll have to deal with that, you know, sort of as we come to bringing the report to council in terms of what has the region done and what does that mean for our proposed bylaw. You know, it may be that, you know, we won't know a final answer from the region. They may not make a decision on Wednesday, you know, or they might give, like this meeting, it might be to give a direction to staff, and it won't be till a subsequent meeting before we see a bylaw. So it's a very dynamic situation. We'll have to really deal with that, I think, on July 13th, depending on where that goes on Wednesday with the council. So I can't really say for sure, but, you know, we will advise council on what your options are at that meeting in terms of whether you wish to, you know, wait until we see what the region does, or to put something in place and you know, then we deal with that after they make their decision. There's a couple of options. It's possible for us both to have, we both have legal jurisdiction in this area. It's not impossible that we both have bylaws, but it would very much depend on what they are, what is in them, whether they would contradict or not. So it's a very difficult thing to know right now. I have to wait and see what the region does, but we'll definitely
Thank you.
advice.
And
We'll
just
provide that advice.
another. Thank you. And just another comment that I think we need to consider availability of masks in the community as well, and affordability of those masks. So I think that is a factor we need to look into. I don't know if the Ministry of Health, the Provincial Ministry of Health, has provided funding for masks, but they should if they haven't. And we need to make sure that there are masks available, and we don't want to have, you know, a run on masks or people hoarding masks, that kind of thing. I don't think that will happen, but I think we need to be cautious about that. Thank you very much.
Thank you, Councillor Williamson. Just some context for the regional meeting. So, and I think if the solicitor can correct me if I'm wrong, the regional council can't direct the chief medical officer for the region to enact something either. We can request a bylaw to be created, but as a body, he has very unique powers that in many respects sometimes supersede what council can do. So that's why the meeting is going to be so interesting, because it'll depend on sort of where the chief medical officer is and where the council is and how they intersect. So I think that meeting will help inform also what we do on Monday. Thanks for bringing that up, Councillor Williamson. Councillor Lilton, you're next.
Thank you, Mr. Mayor. I guess my first question is a question of clarification. I'm thinking if our only thing that's on the table right now, or on the floor, sorry, is do we want council to have staff prepare a bylaw for next week, then all of this language should go. And that's what we should be voting on, because I'm seeing here, this is saying enact a bylaw. This is saying with these details, with these things, because I would like to speak to those, but if that's not what we're actually voting on, then my comments are moot.
Well, it's the direction to staff on what to create the bylaw around, and the items included in that would come from council's consideration as well. So what the motion has done is created a framework for staff to then go away and develop a bylaw in researching what other communities have done as well. So when you look at this was an amalgam of Toronto, and I believe it was Toronto was the base for this one. So this is the base of it. And today's discussion is about what do you want to see added in there, or what are other considerations, such as the date of, you know, does this come into effect immediately and things like that. So we can modify this, but this is the foundation that staff would then go away with.
Okay, so should I, is it appropriate then for me to give some thoughts?
Yes.
Okay, all right, so here goes. Okay, so these are my considerations, and I do have an amendment at the end of this. I want to be super clear in saying that I think people should wear masks. I think you should. I think that we should wear masks. I do wear a mask when I go out, but I do want to make these points. So we know that social distancing works. It has been this action plus increased and frequent hand washing that we have been told to do The public has, for the most part, gotten behind this. We understand that only so many people can enter a store at any given time. We understand that we must keep 2 meters apart from those who are not in our bubble. We have slowed the spread of the virus and are in the position we are now in because we have socially distanced. And this has come at a great cost. Grandparents unable to see and hug grandchildren, the cancellation of school, workplace, community, and religious meetings, no graduations, no organized sports, not to mention the financial and economic fallout. That action has gotten to where we are, namely a very low caseload in Niagara. At last glance, about 27 active cases for a population of just under 500,000. There are about 1 or 2 new cases a day. We must continue this. Incidentally, while I know some people don't want to hear this, I think that because that has shown to work and social distancing is our greatest tool in fighting this disease so far, we might need to have the discussion about what's going on at Sunset Beach and our other beaches. That is not socially distancing. That is putting people at risk. I know no one's going to want to talk about closing the beach, but that, if we are serious about doing everything we can in our power, that might be something we need to look at. Health officials have not been uniform in their thoughts on masks. There's great, from even the letters that we all got, and we got a lot of letters and calls. People are confused about masks. People are thinking they're going to have to wear masks out in the 40-degree weather. The WHO has said, the WHO, which we allude to in our report, and I understand the Centers for Disease Control are saying something else, and this is my point, that non-medical fabric masks, there has been limited evidence on their effectiveness, and the WHO does not recommend their widespread use among the public for control of COVID-19. The WHO goes on to say, for areas of widespread transmission, where there is little ability to social distance, then masks are appropriate. We're not in an area of widespread transmission. We're in an area of virtually no transmission at this point. I understand that this may be changing, and indeed in the Globe and Mail today, Apurva Mandavelli writes that, quote, the virus lingers in the air indoors, infecting those nearby. And that, quote, if airborne transmission is a significant factor in the pandemic, especially in crowded spaces with poor ventilation, the consequences for containment will be significant. Masks may be needed indoors, even in socially distanced situations. So in Niagara, according to our medical officer of health, Dr. Hergy has said, quote, masks remain demonstrably less effective than physical distancing or staying 2 meters away from another person. And he worries that masks will create a false sense of security. Also, removing a mask improperly can increase the spread of the virus. Dr. Hergy said masks are recommended when the physical distancing is not possible. However, he said masks have to be worn properly and noted many photos that show people not doing that. So I do also want to mention that I'm concerned about the potential backlash. We did allude to this for people that can't wear masks. Some can't be bothered to wear them, others cannot wear them. So some people can also not be vaccinated. But in a crowd, we can't see those people. Those around those people in a crowd protect the unvaccinated because we are all vaccinated. However, if someone in the crowd cannot wear a mask, they might need to now worry because we can actually see that they're not wearing a mask. And I'm worried about verbal repercussions, verbal abuse, things like that might happen, or people that just take it upon themselves to be the mask police. So I understand that much of the reasoning behind this is because we want to make sure that we continue moving forward. We all want to move forward. I want to move forward. I want to get to stage 3. I'm very concerned about what going backwards or remaining in phase 2 might mean for us, particularly women who deal with a work/family life unbalance at the best of times, as well as children, business owners, et cetera, et cetera, et cetera. We need to move to phase 3 as fast as possible. But when we enact bylaws, we also have to have at least an outside chance of enforcing them. So now I'm hearing from this discussion today that we wouldn't actually be looking at the individuals coming into wherever they might be coming into these enclosed spaces, but rather the operators being the ones to control that. So I don't even know how we could make somebody, if I own XYZ business, make people who come into my facility wear masks anyway. So we do need to look at that. But I do want to be clear. I think people should wear masks. I absolutely 100% do. But I don't know that I support a mandatory bylaw. So I'm glad that we are going to discuss this, but here's my amendment. I think that we need to create, more than anything, an awareness campaign, a communications campaign to explain when masks should be worn, how to wear them, and how to do so in an effective manner. I'd rather see something like that right now than coming down heavy and say, everybody wear a mask. Another consideration might be that we have actual data that, for example, as I just alluded to, the actual contact to people, I don't know what the medical term would be, but infection rate perhaps is so low. I believe the doubling period of our current cases would take more than 200 days or something like this, which is 3/4 of a year. So I don't know that now is the time to put the mask in. Maybe we need someone to do the data. Maybe we need to ask Dr. Hergy, when would be an appropriate time? If we see that all of our hard work is starting to come undone and we want to shut it down. And yes, I understand that perhaps asymptomatic people are walking around with the virus right now. I understand all that, but that's why we need to get this information. Maybe there's a trigger point where we say, okay, now we're going to enact the bylaw because we don't want to unravel that. So maybe we need to look at that as a second amendment. Thank you, Mr. Mayor.
Okay, thank you for that. And so can we get the amendment on the floor in red? Okay, so I'm first going to look to the CAO. If we pass this tonight, can we have communications start to work with public health to at least start to create an education campaign around the appropriateness of how masks should be worn and stuff, so we don't have to wait a week? Is this possible that this can go forward quickly?
Through you, Mr. Mayor, yeah, that's possible. I mean, I think that's also a very positive step. With certainly the ways that we can keep ourselves safe and stop the spread has been a communication emphasis from the beginning. And so to expand this to as masks become more popular would be very appropriate, yes.
So to the council coordinator, can you move that one to below the last one that you have there, Evan, just because it's outside of the space that we're talking about, and put it underneath the, yeah, put it there. And then I'll look to the mover, Councillor Townsend.
I would see that as friendly.
Okay, so we'll leave that in. Thank you, Councillor Littleton. We'll be also looking at some of the other issues that you brought up. I believe Councillor Kushner's on the docket.
Yes, thank you, Mr. Mayor. Mention has been made of the exemptions and how forceful can we be. We received correspondence from one person suggesting we change the may to shall, and I would certainly agree with that. Shall makes it stronger. It gives the message that we will make exemptions if you meet the criteria, and therefore I would suggest that be the change, albeit a minor change.
Okay, so we'll put that on the list for staff to include in the bylaw for consideration. Wordage of the use of the word shall.
Yes, thank you. And my next question is with respect to stage 3. Do we know what the criteria are for stage 3?
Who do I look to here? Do I go to the CAO?
Through Mr. Mayor, we do not. Easy question. This very specific criteria of how the choices were made as to which areas would be stage 2, move from stage 1 to stage 2. There were not very specific data-driven amounts released. Generally, they've just said as things get better and as we hold and monitor. So the very specific criteria we do not have, no.
And how many stages will there be in total?
4.
So 4 would be reopening the economy in its entirety.
Yeah, pretty much the Meridian Center and the First Ontario Performing Arts Centers. And I can go to Director York, who's been on the line with a number of the different agencies that are looking at this.
Yes, through you, Mr. Mayor, stage 3 is a return to normalcy where we're starting to open up indoors, indoor operations again. Stage 4 would be there's a cure. We return to complete normalcy. The provincial plan has 3 stages. The city plan, we added a 4th, and that would be we found a cure, or somebody found a cure.
Right. Well, Mr. Mayor, I'm fully supportive. I think the motion is very well researched. It refers to every possibility. It refers to, it doesn't explicitly refer to stage 4, but to me, that's the intent of making the wearing of masks mandatory. We all want to get to stage 4 as quickly as possible. We want to save lives and we want to kickstart the economy, because the mental portion of not being employed is very critical too. And now the directors of health are paying more attention to the aspect of people not being able to go to work, not being able to go to school, and so on. So I see this as being very proactive rather than reactive. We're slow to get to stage 2, but I hope by taking the initiative here, we're joining other communities, and the more we do so, the quicker we'll get to stage 3 and the better off our residents will be. I share the concern that was expressed that if we do implement this, then there's a possibility, as we've seen in the States, that residents who have a strong opinion, either for or against it, get into altercations. They can be verbal or physical, but I think as Canadians, we are more respectful of the law, respectful of government, and therefore I don't see much of that happening. Thank you.
Thank you, Councillor. Well said. In terms of, I've heard from Councillor Littleton, Councillor Kushner about the medical officer for the Niagara region. And I'm wondering if we can add an amendment to the motion that requests his participation in the July 13th meeting.
So moved.
If they can have that, if that could be added to the screen when Evan gets a chance. And again, depending on what he says, but if not him, then a member of his team. I think there's a lot of questions that have been brought up that would be best designed for him or a member of his team, because we only have limited experience dealing with this, and he's been dealing with it every day. So Councillor Townsend, is that a friendly?
Yeah, and this is something that I was hoping to also add as well, to have public health be part of the conversation. So yes, it's a friendly amendment, and I think it's important to have some public health input on at the July 13th meeting.
Okay, thank you. Councillor Dodge, you're up next.
Thank you, Mr. Mayor. I can say that I do agree with a lot of what's been said already. And if it's possible at this time, could I make a couple of amendments?
Okay.
Or recommendations? Yep. So be it further resolved that the bylaw provide that a date on which the bylaw is to come into force and the date on which it shall expire shall be dates to be determined jointly by the mayor and the CAO in consultation with the Niagara Regional Medical Officer in Health.
Okay.
And then, oh, sorry.
Yeah, that's good.
Okay.
Okay. And so this is, do you want to provide some context? Because you had there was a discussion that you were a part of, and it's pertaining to, depending on what Dr. Hergy may say at next week's meeting, we want to potentially have an open date on the enforcement part of it.
That's correct. And I mean, if there was to be a spike or anything like that, it would be, I think, very helpful that you as the mayor and the CAO, in consultation with them, that you can act quickly. We don't have to come back and address anything. It's there, it's ready to go at any given time, because we just don't know what can happen with this disease or this pandemic. Or
so I think this speaks to what Councillor Littleton was speaking about.
Mm-hmm.
Okay, and then I'll look to Councillor Townsend.
Yeah, I would see this as friendly, and I do agree with Councillor Dodge that it's important to have us give us the ability to act quickly on this matter. So yes, I would say it's friendly.
Okay, thank you. Councillor Dodge, anything else?
Yes, be it further resolved that the city's solicitor be directed to prepare a draft bylaw for consideration at the council meeting of July 13th, 2020.
Okay, so that's housekeeping. Thank you for that.
You're welcome.
And then I think there's one more, which is to accept the report that was put on the floor by the solicitor, the one that just came in. So that's LCS 104/2020. And I don't know if that's on the floor yet. And that's to receive that report. Is that included yet? There it is. That's another housekeeping one. Okay, any thoughts on this, Councillor Dodge, or is that it?
I think that some of my comments have been expressed by other councillors, so I won't go back in.
Okay, thank you for that. Councillor Cisco, you're up.
Thank you, Mr. Mayor. One request with respect to the exemptions list, I'm hoping this will be a friendly amendment that we add regulated health professionals to the list of exemptions. A lot of the different regulated health professions have very clear guidelines with respect to this, and in dealing with different types of patients, there may be situations where it's not appropriate. So I'm hoping that would be a friendly amendment.
Okay, so the wording on that is a regulated health professionals. Okay, looking to Councillor Townsend.
I guess I just have a question, because I know like some, are we referring to like say chiropractors, like RMTs kind of thing? And don't say even like dentists, don't they get regulated by like the Ontario colleges of say dentistry? Or I just want to make sure I'm following correctly what the ask is.
Yeah, that's exactly it. Where they have professional colleges that would put down regulations with respect to how they are to govern themselves. So those professional medical organizations have their sets of rules, and I would think it would be important to hear what those regulated professions organizing bodies have to say. That's all.
Okay, yeah, I would say that's friendly then. Thank you.
Excellent, thank you. And just to the motion, Mr. Mayor, I'm firmly in support of this. I've heard a lot of arguments for and against over the last couple of days. Most of the arguments are for, and they come from very, very different fields and different individuals. I think this is a good step forward, and I think the changes that Councillor Dodge suggested with respect to being able to enact this, but also pull it back, to hold off on putting it in place if there is no need. I would look forward to hearing from Dr. Hergy or a member of his staff as to what exactly they feel would be the correct triggering mechanisms. And I think that would assuage a lot of the concerns that folks in the community have, that this is a tool in the toolbox. We've used a lot of tools over the last couple of months to try and deal with the COVID-19 pandemic. But this would be another tool for the city in the event where things start to turn, and where if we were to see things moving in the direction that we see with our neighbors to the south. I don't think that will happen. I think Niagarans in general and Canadians in general have been much more responsible in that respect. But I think this is an important tool, and I hope council moves it forward so we can have that debate with Dr. Hergy. Thank you.
Thank you, Councillor Cisco. And we got Councillor Porter and Councillor Phillips. And Councillor Garcia.
Thank you, Mr. Mayor. I'll be brief. I just want to start with a brief comment, and then I have a question for staff. Some of the other councillors have made amendments that I wanted to make already, so I think the motion is looking pretty good so far. We received a lot of feedback. One of the case studies I want to point out is a difference between New York City and Hong Kong. They're both jurisdictions with similar size, similar population density. And as soon as the outbreak happened in Wuhan, like Hong Kong has a high-speed train to Wuhan, and it has packed public transit, but over 99% of the population voluntarily chose to wear masks because it wasn't mandated by the government. And by the middle of May, Hong Kong had 4 COVID-related deaths, and New York City had over 20,000. There's a growing body of evidence that widespread wearing of masks help to keep us safe. So I'm fully in support of this. My concern, I share the concerns that some of the other councillors have around discrimination. And I'm wondering if staff would be able to reach out to other municipalities, Guelph, for instance, to find out how they're enforcing this and how they're ensuring that people who can't wear masks in stores aren't being excluded or discriminated against. And if what those municipalities are doing in response. I'm wondering if there's time to do that before the next meeting.
To you, Mr. Mayor, to the councillor. Yeah, it's our intention certainly over the next week to be in contact with all the municipalities that have bylaws, as well as those that are considering them. There is a call on Thursday among all the in-house municipal solicitors with respect to these, because this is a pressing issue in a number of municipalities, and we'll be sharing some best practices with respect to that. From what I understand, from what I've seen already, is that, I mean, because of the way that they're being required to enforce these, where it's the operatives of the business, where there are these exemptions that you don't have to wear a mask, for example, if you have a medical condition, or you can't wear one because you're not able to breathe properly with it. My understanding is that the direction that they've given to the business operators is not to challenge that and not to ask for proof of it. If a person declares that such is the case, then they are being advised by the municipality to simply accept that declaration. And they're not asking for proof of any of these reasons. So my understanding is that's generally how they're approaching it in the other municipalities that have enacted the policies thus far.
Okay, thank you very much. That would be something I would be in favor of, is to just accept a person's declaration without any further questioning or asking the resident to provide proof. I think that is intrusive. So thanks very much.
Thank you, Councillor Porter. I think we got Councillor Phillips and Councillor Garcia.
Thank you, Mr. Mayor. Many of my questions have been asked. One question in coming down today, I guess it was, is the fact that if this is invoked on Monday night in the mandatory wearing of face masks, the stores will be responsible for making sure the bylaw is carried out. How is that going to be done? Like, are we going? We're not going to have a bylaw or a COVID police bylaw officers going around, I understand, but will it simply be a situation that there'll be signs up at every store, and if someone says I'm not wearing a mask, they're not going to come in? If there's a confrontation, what happens in a case like that?
So that's a lot to consider. I don't know if the solicitor has.
It's a concern, Mr. Mayor. That's I think we're putting the stores in a tough spot.
Right. I can go to the Director of Economic Development, and reason why is that we've been the quarterbacking ever since the beginning as a city on the business side of it. So from Director York's position, the not necessarily enforcement, but the education side.
Thank you. Through you, Mr. Mayor, to the councillor. Like other municipalities, it's educate to comply, much like we've done with the balance of enforcement regarding COVID-19. We want the public to comply. So the goal would be to get the public to comply and the numbers to continue to come down. As in the case of Toronto, the bylaw puts a policy in effect that it's up to the establishment to enforce the policy. So we can go the bylaw enforcement route, or we can go the policy and educate to comply route. But those are the two paths.
What happens if the store isn't really, maybe they don't agree with it, whatever, if they don't comply with it, what happens then? Are in other jurisdictions, are fines levied to the store, or if they don't comply after a couple of warnings, or what happens, you know?
So through you to the councillor, through you, Mr. Mayor, to the councillor, I don't believe any of the information we received has a fine set limit in it yet. And that's some of the work that legal and our team will do over the next week to prepare and share with council. But in my interpretation, yes, enforcement would be maybe the last choice, but that would be the next step.
Okay. And perhaps, Mr. Mayor, to you or to the CAO, we've indicated that if this bylaw is invoked, it's up until August the 24th. What determines whether this bylaw is lifted at that time? Is it as soon as stage 3 is declared, it's going to be automatically lifted, or what parameters are there that will decide that?
I'll go to the CAO and Shelley, if you want to provide some.
Sure. Through you, Mr. Mayor. Well, one of the amendments, Councillor Dodge, I believe, introduced the amendment to actually enact the bylaw, but have a secondary date to be determined when it comes into force. And that's joint decisions between CAO and mayor in consultation with the medical officer of health. So should this bylaw go forward and be enacted, that would be what we would be talking to the medical officer of health with, is what would be their public region health is where we would get the information as to the cases and to what is happening in the community. So as we would determine to enact it, put it into force, we would also say at the same time, those are the things that would cause us now to be able to lift the restrictions. It would be basically, you know, what is happening in the community, what's happening with the transmission of the disease, and are we seeing it much improved? One hopes that it would become very obvious that we no longer need it. That's unsure at this time. But basically how we would go in is how we would determine to go out.
Interesting, because as Councillor Littleton said, we have 27 cases in Niagara with a very large population. I think our residents have done extremely well in doing this and keeping the numbers down. I don't know how much lower we can go before you know, we say, okay, we don't have to wear masks anymore if this is invoked, because we've done, I think, a really, really good job. And again, I support the use of masks, and when we're in a high density area, Susan and I also, you know, we do wear masks, but and it's good. We're not going to invoke the mandatory mask bylaw tonight. We'll have some time to think about it. Thank you. From sunny New Liskeard.
The solicitor, Director Salter.
Thank you, Mr. Mayor. Just for clarity, the original text of the motion has a paragraph that says that the bylaw be enforced beginning July 14th and expiring August 24th, which I believe is the sentence that Councillor Phillips was referring to. I think in light of Councillor Dodge's proposed amendment, where the enforced dates would be at the discretion of the mayor and clerk, I think that's kind of contradictory. So I think it would be in order, if the mover of the motion's in agreement, to strike out that sentence about, yes, the one that Evan has highlighted, thank you, then they're no longer contradictory. It'd be a little clearer for people, I think.
To the Councillor Townsend?
I would agree, yes, that would make the most sense.
Okay, thank you. Thank you, Director Salter. And I think Councillor Miller. And then
just one question, I think, through you, Mr. Mayor, to Director of Legal Services. I'm in favor of the mandatory mask bylaw, and obviously people wearing masks. But about a month, just over a month ago, we had an email from the director talking about the difficulty in enforcing it, and we've just touched on that in some of the questions. With the change, or maybe the change of perspective that we're looking at regulating business or working with businesses rather than maybe individuals, does that make it any easier to enforce? I mean, again, I'm in favor of this, but I'm not in favor of a bylaw we can't actually do anything about. So does this make that easier or more effective, perhaps?
Director
Salter. Through you, Mr. Mayor, to Councillor Miller, absolutely. This does change it completely, both in terms of it being enforceable and manageable. Yeah, this makes a big difference.
Okay, all right. Good to hear. I guess, is there any consideration that we might need more bylaw officers, which I know is a frequent topic of conversation, but I guess maybe to the CAO, you know, is there a feeling that we're adding a significant new bylaw? Our bylaw officers are pretty taxed as is. Is there any consideration to increasing the complement of bylaw officers moving forward?
Through you, Mr. Mayor, I do need to say, regardless of this bylaw, we probably do need to consider going forward having increased bylaw officers, not generally as a result of this bylaw, but they are very taxed in this situation. And it is an area which senior staff are looking to right now to determine best practices in our complement for bylaw officers, yes.
Yeah, and I think that's important for us, hopefully, to keep in mind as we add new bylaws, as we know we do all the time, and significant ones, that when this conversation comes up, that we're ready to have that, because I think we're putting a huge burden on a very small number of people right now. So that's all for me. Thank you.
Thanks, Councillor Miller. Councillor Garcia, you're up.
Thank you, Mr. Mayor. I have a couple of comments and some questions, and then an amendment that I sent in that I would like to table. Being one of the last councilors to speak, again, a lot of my questions have been answered already, but I just want to emphasize to my fellow councilors and the public that I see this as a very difficult decision because we've gotten a lot of public input, a lot more than we get in many issues, and a lot for and a lot against. And I think Councilor Sorrento probably hit it right on when he said it's probably 3-2-4. But the people who are against it make some coherent arguments as well, which have been mentioned, I think, by Councilor Littleton again regarding the fact that we have so few infections, and are we really doing this too late? Is it really necessary, and so on? Having said that, I wrestle with this, and I do still think that I have to support this simply because I have such horrible fear of what's happened down south. And while we have such few infections, the reality is we didn't reopen until very recently. So when you look at the 2-week incubation period, there could conceivably be things happening because of the partial reopening we've had that we don't even know about. And, you know, we have a responsibility to the public, we have a responsibility to our businesses. And I know businesses are suffering, and I always want to support our businesses, but again, the reality is if we do take a step back, businesses are going to suffer even more if all of a sudden the reopening that they have has to be curtailed. So it's all in all, I believe it's a good step to take, and I agree with my colleagues that we tend to be much more disciplined than Americans, and I'm hoping that we will be respectful of others' rights and not start yelling at people and so on. But I have a couple of questions. One of them being of the city solicitor, and that is some of the emails that we have gotten against this potential bylaw have stated that they feel this is a violation of human rights or a violation of their rights, and I would like her to comment on that. Is this bylaw in any way appealable under such kind of statute?
Through you, Mr. Mayor, to Councillor Garcia. Certainly, I've seen some comments in some letters and commentary on this subject that suggests that these types of bylaws or orders broadly violate civil, political, or human rights. But interestingly, none of them have actually identified any particular right that is in fact violated. There does not appear to be a charter right that is clearly infringed by such a bylaw. Having said that, I mean, that certainly doesn't stop an individual or an organization from choosing to challenge these types of bylaws if they feel very strongly that that's the case. But I have to say I'm quite comfortable with it in terms of the authority of council. And, even when you're talking about charter rights, and again, there isn't one that is very clearly impacted by this sort of a regulation, but even when you look at charter rights, it is permissible to limit the freedoms under the charter, provided that the limitations are reasonable. So in drafting a bylaw of this nature, I mean, that really becomes the test, right? The threshold is you do have to make sure that the limitations are reasonable in the context, in terms of what are the risks, what is the situation you're facing, and also in terms of those things like the exemptions, how you've accommodated, things like, medical disabilities or other sorts of personal characteristics. So that's where you address those types of concerns, Councillor Garcia, is by being very careful in terms of the drafting of the bylaw to make sure that you've provided for those, those types of exemptions that are necessary, because certainly, Ontario Human Rights Code, for example, I mean, you cannot discriminate against people based on, the enumerated characteristics. So our bylaw needs to acknowledge that and ensure that, our bylaw is not requiring that to happen. And if we're expecting businesses to enforce them, I think it's incumbent on us in terms of our communications to, articulate that to businesses and explain that, that is a requirement in terms of enforcing this bylaw, that they need to be respectful of those sorts of exemptions. And I think that's the way that you address that concern.
Thank you.
Thank you, City Solicitor. And through you, Mr. Mayor, the other question of the City Solicitor I had was, you have pointed out that the medical officer of health had some special status, I guess, somewhat similar to the clerk in our city situation, for example. What happens if there is a couple, in other words, if the medical officer of health warden says, does that mean that we cannot then pass the bylaw?
Can you just quickly restate that, because you're going in and out. If you just restate that just quickly.
Okay, sorry. Considering that the medical, for some reason I'm having a bad connection here. If the medical officer of health comes out against masks and says, no, do not wear a mask, can we pass the bylaw telling our citizens to wear a mask?
Okay, so the gist of that, if you didn't hear it to the director of legal, is that if the chief medical officer says, no, we can't wear, there's no need to wear masks, can we still pass a bylaw? Do we still have the authority to do so?
To Mr. Mayor, Councillor Garcia, when you're passing a regulatory bylaw that is based on your jurisdiction to address so the health and well-being of the community, there's an expectation that there is some evidence to support that. But I mean, there's certainly ample, I mean, it's a difficult question, Councillor Garcia, because who do you listen to? And in this particular situation, there's many different voices that are speaking and not necessarily all in agreement, but there certainly is a body of opinion that is out there from the medical establishment, from people who can speak to this, with authority as medical experts, who are in fact recommending the wearing of masks. So at the end of the day, I mean, we would certainly hope to be in alignment with our own medical officer of health, who is, the authority in this jurisdiction. Is it an absolute requirement that Dr. Hergy supports it? No, it is not, but we will need to, identify some sources, in the medical establishment that do, in fact, support the wearing of masks as a one means of limiting the transmission of COVID. And I think there certainly is information like that is available to us.
Thank you.
Thank you to the City Solicitor and to you, Mr. Mayor. So I definitely am going to support the passing this motion. Like Councillor Littleton, I wear a mask everywhere that I go, and I make sure I do. And I know it's a challenge, and some people don't like to do it, but I guess I like everyone out there to hear, and particularly our businesses, that this is for the benefit of everybody. We're not trying to hurt businesses, but in fact, we're trying to help them, because if there was a resurgence, that would be horrible for them. So having said all that, Mr. Mayor, I'd like to table an amendment which I sent in, if perhaps Evan can show it. And this amendment is to create an exception, I said, but maybe exemption is a better word, to particularly address it to helping facilities like the PAC. Councillor Townsend and myself are on the PAC board, but it would apply not only to the PAC situation, but other facilities where performers may be allowed to perform. And so the way I worded it was that that exceptions be provided for occupations such as singers and others who would not be able to perform their duties with a mask on, providing proper distancing is maintained. And certainly I hope that that will be considered friendly by Councillor Townsend.
Councillor Townsend?
Yes, and I think the key words to point out is that provided that proper distancing is maintained. So yes, I would say this would be friendly.
So before we, can we look to the solicitor? The only comment I would have is that the others who would not be able to perform their duties, that's very, very broad and vague, because by your comments, you're directing it to the creative class, such as singers and theater people who have to perform with their voice. And then it says others who would not be able to perform their duties. That could be anybody. Like that could be,
yeah,
which is already covered in the, so is that your intent? Is that anybody else who can't perform their duties?
Well, Mr. Mayor, the reason I added that was because I could not think of who else besides singers would be in that position. But for example, I think some of your motion mentions athletes. It could be, back to the arts again, it could be a performer that is doing something very athletic and therefore a mask would hinder them. I'm not sure how we can cover that, but if everybody feels that that is covered, as long as artists are protected that way, I'm happy to remove that if you feel that's too broad.
I'll ask the solicitor because we want to make sure this is as tight as possible.
I think that with these sorts of exemptions, this is the type of thing that I would really wish to consult with public health on to get their perspective on this. I mean, they're definitely, and I've seen in some of the orders and bylaws, that there are exemptions related to, obviously certain types of professionals can't perform their duties with a mask on. But generally, Occupational Health and Safety Act is going to determine what sort of PPE they would be using. And this is the same sort of scenario as in the health regulated health professionals. They have their own requirements.
So
it's very open-ended, and I'm not sure, I could not, it would be too vague to put this in the bylaw in the way in which it's drafted. So, I mean, I'd have to take this as direction to sort of look at this scenario and see, in speaking with public health and looking at what other, municipalities are doing, to see if there is a way to reflect this in a way that's both enforceable and meets sort of the general purposes of the bylaw, which is the protection of public health.
Okay, so if I can ask, Councillor Garcia, can we move that under to directions to staff?
Sure, no problem, Mr. Mayor. And I was going to say we can hone it and focus it on entertainers perhaps more, but I want to point out that this isn't just about the pack, but for example, as reopening is happening, and we have patios that are that have the space for somebody to perform. We want them to be under the same kind of exemption, providing the distancing is provided and other performances if and when, for example, the Meridian Center opens and so on. Okay.
Oh, Director York, just for information.
Yeah, through you, Mr. Mayor, to Councillor Garcia. Currently under stage 2, live entertainment is not permitted. So I think it may be best to take the direction from the province under what we can do under certain stages. And stage 3 still set the rule of order under stage 3 doesn't permit large gatherings. So as Mr. Mayor had earlier stated, the Meridian Center and facilities like that won't come back until it's safe to do so. So I think it's best left to the province to address what can be done under the stages, and that the mask discussion follow the direction of the stages.
Thank you. And through you, Mr. Mayor, to Director York, I did send an email to the CAO pointing out that someone from the arts community had asked because they said that they understand that wineries are having live entertainment, and she was saying, you know, why are our businesses downtown, for example, and in Port and Marathon or wherever, not being able to do it if wineries can? And it's something, I don't know that you can answer that right now, but if not, it's something that we need to look into to make sure that we're being fair to everybody.
Through you, Mr. Mayor, I'm not familiar with the wineries having live entertainment, but we'll certainly follow up with bylaw and look into that.
Okay, thank you, Mr. Mayor. That's all.
Garcia, Councillor Harris for the first time.
Yeah, I guess like everybody's put a lot of work into this, and everybody's put a lot of thought in all the amendments, and it's ideal that we're going to speak with the region and public health. My question is, if we're talking about having businesses enforce this kind of mandatory masks, how is that any different than when you see a sign that says no shirt, no shoes, no service? Like, how would it be any different than saying no shirt, no shoes, no mask, no service? I guess I don't know who would answer that question, because
I think that would be a public health directive that you can't go to a store without any shoes on and
shirt, or
no one wants to see me without a shirt on. So I know that would be. So from a public health perspective, I think that's where the direction comes through as well, getting them to, that has to be part of some kind of regulation. But I'll look to, I'm not going to answer that, Director.
yeah, I just was saying that. So that's it. But everybody's done a good job and lots of good amendments. So keep up the good work.
All right. Thank you. Councillor Littleton had an amendment, second amendment she wanted to add.
Sorry, everybody. This is going back before Councillor Dodges went on the floor. I'm looking for more of a specific number that is going to be discussed with the, I believe Evan has the wording here. I don't know where it is. I'm just looking before that, the bylaw would be enacted, that through discussions with the medical officer of health that we come up with that number. We're talking about science. This is all numbers. It's all, you know, infection rates, increases. I want to know what that number is. And that's when the bylaw gets enacted. So it's not emotional decision. I think that there's this happening, or this might be happening. Medically, it's been proven. This is the infection rate. We're starting to hit numbers that are concerning. This is why we're enacting the bylaw. So it kind of goes along with what the city solicitor just said as well, where we need to have the reasoning behind why we're enacting the bylaw. So thank you. I just wanted to make that point. Thanks, Mr. Mayor.
So thanks, Councillor, and Councillor Townsend. So it is, what are your thoughts on that one?
Which we're just talking to the last point here.
Yeah. Preferably that would come out of.
Isn't this the same thing as what we just asked though with the mayor and the CAO if cases do increase? Am I?
Yes.
Isn't this kind of
it is, but it's more specific. I'm trying to make it, because the mayor just said as well, we want to have as tight as possible. That's what mine is. It's just getting that tighter. That's all.
So would this better be designed after the discussion? So can we hold this one after the discussion with medical officer of health? And the reason why I'm saying this is because St. Catharines took the lead on a lot of these initiatives, and we had to bring public health along. So talking about tying hands, what we have to be cognizant of is that in the situations that we're in, we actually moved quicker than public health. And it proved to be actually very important that we did. So I think maybe leaving that motion for next week, and if we can get some clarity around what would be the best times to bring something like this forward, I think that would be, and if we're comfortable as a council that he's given us that clarity, I would be more than willing to consider that. But at this point in time, I think there's been a lot of concern over certain situations that have arisen where we had to act quicker. And quite frankly, our actions is what kept St. Catharines, Niagara in a very good state.
Yeah, and Mr. Mayor, I would just quickly add on to that too. I would agree with that too, because we don't know how long it would take for the Ministry of Health to get back, medical officer of health. I don't feel comfortable adding this into the motion. It might be something to look forward to, like to the July 13th meeting though.
I think it would be a helpful discussion, because in the absence of that, and when asked to Dr. Hergy himself, when would this come into effect? If he still doesn't have an answer for that. So I think it's important just to get that onto the table at Monday's meeting with Dr. Hergy, as to what would he determine to be a time in which this would come into place, so that we can better understand his line of reasoning, which has been, it's been hard to gather lately. Okay.
Okay, that's fine. I'll add it to my list of questions for Dr. Hergy next week.
Okay, perfect. So we've got a couple more hands. Does Councillor Sorrento, is there anything, because this is the second time, I don't want to go around the horseshoe. I think we've got a tight motion here.
That's very good, Mr. Mayor. I just wanted to speak to the amendment, and it's my esteemed colleague from the Southern Tier, and the question through you, Mr. Mayor, to either the solicitor or the deputy clerk is the differentiation between the two verbs may and shall and what the implications are.
Okay.
Thanks, Mr. Mayor.
To the solicitor, just very quick summary on that.
You, Mr. Mayor, to Councillor Sorrento. Shall is directory. It requires you to do something, whereas may does not necessarily require it. That satisfactory?
Yes, thank you, Mr. Mayor. Okay. Thank you, solicitor.
So that's something that you can circle in when the draft comes, and what that means as well. We had the deputy clerk had her hand up. I apologize. I didn't get to her. Ms. Sullivan?
It's been addressed.
Okay. And then anybody else? Is Councillor Dodge, your hand's up. Do you have something to, no comment, just sort of, and then we got to go to Councillor Townsend for summary remarks.
Okay. Thank you, Mr. Mayor. I just wanted to have a little comment about maybe in the education portion, other councillors have brought this forward as well about the fact of, people that aren't wearing a mask. I think that people will wear masks now, even if it isn't mandatory, but there are some people that just can't. And I would like to, if we could, in the education part, maybe put something in there so that people can understand and be told right from the get-go why some people don't do it. And I know that there are some people that can't wear a mask, but because of peer pressure or whatever, they try to wear a mask and then they have other complications because of that. And I would like to, hope that we could maybe at some point really emphasize the reason that some people are not wearing a mask and get that as part of the education out there.
Okay. So we'll add that to direction for the communications piece that Councillor Littleton was made the motion for.
Thank you.
Councillor Dodge. Okay, Councillor Townsend for the wrap up.
Thank you, Mr. Mayor. It's been a lot of, obviously we've been diving into a lot of information. I feel like I've become maybe somewhat of a mask expert the last few days. We've had a lot of emails, a lot of people against, a lot of people in favor. I've been on the fence, but I think that where it changes my perspective is that as elected officials, we have a responsibility to make sure that we put in safety measures for this type of virus. We've seen what it's done south of the border. We've seen spikes out in right here in Ontario. And I think that if we can get this bylaw, something developed around providing some sense of security and safety for the residents here in St. Catharines, I think that just will allow us to move into stage 3 much sooner than later. The last thing we want to do is we don't want to be progressing backwards. We want to continue going full force forward. And a lot of people who may have been emailing concerns that, you're trying to take my right away. No, I think that people in the public need to understand that council cares. We're here to put this type of bylaw in to make sure that we're not spreading this virus. We're making sure that everyone feels comfortable going out into public. I've been out and unfortunately, I've seen cases where physical distancing and masks, physical distancing is not being practiced. Wearing a mask, you feel that security. So I just want to say that I hope council will support this going forward. And I think it's important for us to have these policies, these procedures ready to go in case we do see a spike in cases, because we don't want to be the last municipality to be implementing something later when it's way too late. I did want to just quickly jump onto I do appreciate the educational campaign that Councillor Littleton and Councillor Porter had mentioned. I think one thing that would be important to include in that campaign is discrimination against those that are unable to wear a mask. I've seen campaigns where They've included a sense of, don't be making fun or discriminating against others who can't wear a mask, because I think the public do need to understand that there are some people that can't wear these masks. So that's all I have to say, Mr. Mayor. And again, I believe that we do have a responsibility for public.
Thank you very much for leading this, Councillor Townsend. It is greatly appreciated. And for anyone else who's watching, I will just say that we're not an island. And so we're not Prince Edward Island. We're not Newfoundland without the Labrador part. We're not Newfoundland. It's really, we're a destination. So this weekend alone, had an opportunity to drive around. I was in Lincoln area. Folks, I saw plates that had Quebec plates. I saw New York State plates. I know Councillor Townsend saw Connecticut plates. We are a destination. When you talk to the mayor of Niagara, Lord Mayor Niagara Lake, they're seeing upwards of 50 to 60,000 vehicles a weekend. So this whole thing that we live in a bubble, we don't. And so I think it's important for the public to understand that we're trying to protect our community, because we don't know what other people in communities outside of Niagara are doing. And what you're seeing in the GTA is, unfortunately, there's increases that are much greater than what we're experiencing here. And the last thing that we want to see is those increases shifting here because we didn't put in enough protections. And this will be a question that will be asked of Dr. Hergy next week, is how do we consider the influx of travelers coming through Niagara? The public has to be aware of that, because we're not an island. And what you're seeing at the beaches, as has been brought up, there's a lot of GTA folks who are coming to our beaches. And so I know that on the 13th, there will be a further discussion about how we are going to potentially address that as well. So stay tuned. That was more of a public announcement. Stay tuned. But I just want to thank the staff and council for this great discussion today. It has been a very focused discussion, and I think we have a strong amendment in front of us. So with that, I'll look to the clerk to call a question.
So we have Councillor Townsend moving the motion and Councillor Kushner seconding the motion.
Yes.
Councillor Townsend?
Yes.
Councillor Williamson?
Yes.
Councillor Dodge?
Yes.
Councillor Garcia?
Yes.
Councillor Harris?
Landed.
Yes. Yes.
Councillor Kushner?
Yes.
Councillor Littleton?
Yes.
Councillor Miller?
Yes.
Councillor Phillips?
Yes.
Councillor Porter?
Yes.
Councillor Cisco?
Yes.
Councillor Sorrento?
Yes.
And Mayor Sendzik?
Yes.
And that's carried.
Okay, we have just a quick bylaw that has to be approved, and a bylaw to confirm the proceedings of council at a special meeting held on July 6th, 2020. This is one reading with respect to confirming. I have Councillor Townsend making the motion, just show of hand, seconded by Councillor Sorrento, show of hand. All in favor? Show of hand, carried. And that is it for the meeting. We have no further business. Councillor Miller, you're making the adjournment?
Yes. Thank you to staff. And I know adjournment's important to me. It's probably my favorite motion. So, so moved.
Seconded, I believe, by Councillor Littleton. Councillor Littleton, are you happy with the adjournment?
Yes, except now I have to go and talk to my kids.
All right, all in favor, raise hands. That's carried. Have a safe week, folks. We'll see you on the 13th, and thank you for everything that you're doing to make our community a better community. Take care.
Thanks, Mr. Mayor. Bye, everyone.